realized that there were evidence-based solutions to not only treat but prevent maternal mental health conditions like postpartum depression and perinatal anxiety in a way that's scalable. Hi, I'm Wanlund. I'm the co-founder and CEO of Canopie. We have a digital platform that we use to prevent and address maternal mental health conditions, the most common and costly maternal morbidity, but only 15% of people who need support get help. So we're looking to change that by integrating maternal mental health into prenatal and postpartum care. So we screen, we provide care, we escalate into additional care if needed throughout the prenatal and postpartum period, and our platform is in English and Spanish. So that's what we do. Canopie was founded at the intersection of research and personal experience. So my co-founder and I actually went through an incubator together and received a research grant to scale a evidence-based solution to a really big problem. I had been working in maternal health for most of my career, but was a new mom and totally, caught off guard by my own experience with mental health conditions. And I thought, oh my gosh, I can't believe that, this is such a common issue and nobody knows about it, but it's so common that we screen for it. I was screened 4 times at pediatric well child visits in my son's first year, and it was his 1-month well child visit when I was screened by the pediatrician and I couldn't talk during the visit. I was so I couldn't talk without crying. So my husband took the entire conversation with her, and she saw me, she saw I was struggling, and I was screened at that appointment, but nothing happened. And that really stuck with me, that, why is there this disconnect? This is obviously a public health issue. This is so common that we're screening for it, and yet there's no conversation at a moment when there's all this opportunity. She saw me. And so, we realized that there were evidence-based solutions to not only treat but prevent maternal mental health conditions like postpartum depression and perinatal anxiety in a way that's scalable. So you can use digital interventions to actually head off the worst consequences of having a mood disorder. And it just made no sense to us that, people are getting care too little too late, and we wanted to just fix that. So I would say what gets me out of bed in the morning is knowing that we're having a real impact on people's lives. I think that when I'm feeling like, oh my gosh, this is so hard, or I can't believe, the mountains we have to climb that are in front of us, I just look at our research, I look at the feedback that we've gotten from moms, and it's just really powerful, and it just keeps me going. And I think about, how different my own experience would have been, and it's a very, very personal, very kind of intimate time in your life, this transition from pregnancy to postpartum. And I think it's something that, requires actually some personal experience to really address the issue, get it right, and to keep going. Because there are absolutely obstacles to, integrating mental health, especially prevention-based mental health, into, care. We realized we had this evidence-based solution. We knew it worked. We had a very long research and development process with moms, with experts, with policymakers, with kind of everyone. And we realized that there was a business case for what we were doing, because not treating maternal mental health conditions costs the U.S. healthcare system about $18 billion a year. So it is a hugely costly issue, and through an intervention like ours, about half of those costs can be prevented, and half of the negative outcomes associated with maternal mental health conditions can be prevented. And so we really work on kind of the value-based side of healthcare, where we're focused on prevention, clinical outcomes, measuring those, and that's how we generate revenue. So we work with health systems and we work with payers. But we've also got some exciting other partnerships. Canopie recently expanded our solution, so we now not only are able to do that kind of prevention and early intervention work, but we're able to create additional care pathways to make sure that we have provider group partners that can address the more complex cases to make sure that nobody goes without the care that they need. So this next year, 2023, is going to be a big year of growth for us. We have some really awesome partners, customers, and we're working in some really cool markets where I think that we'll be able to kind of take all of what we've learned over the last few years, and our product is in such a good place that we can just kind of focus on scale and growth. We've got a great team in place, great partners, and I'm really excited for the next year.